So, welcome everybody to the COVID Chronicles episode 2. Today is going to be more like a podcast. You'll notice that we're not using the video feature for this one. The reason for this is I spoke to Keith Noseworthy, who's going to be our guest today. It's been a little while since he's gotten into the hairdresser thanks to COVID. We didn't want to expose everybody to his Larry David-like hairstyle. So I thought best to turn the cameras off for this one and hope you guys can tune in and listen along anyway. So Keith, for those who don't know you, Keith Noseworthy is a pharmacist at the Miramichi Regional Hospital. And Keith, I'll let you introduce yourself to the listeners and tell us a little bit about who you are and what your role is in Miramichi.
Sure. Thanks, Heather. Well, my name is Keith Noseworthy, as Heather pointed out. I'm a staff pharmacist here in Miramichi. I work primarily in antimicrobial stewardship. 0.3 of my time is spent working in antimicrobial stewardship, and I also work clinically on our family medicine and cardiology floors.
Okay, great. How big is the Miramichi Hospital? How many beds do you have?
So we have about 160 beds. In terms of acute care right now, I think we're probably feeling the same crunch bed-wise as most other areas within New Brunswick. We have 2 of our units are actually devoted to long-term care patients right now who are awaiting nursing home placement. So in terms of acute care beds, I would say we're probably down to around probably 100.
Okay.
Yeah.
So yeah, and for your pharmacy staff team, how many pharmacists, technicians, and assistants do you have working with you?
So I think in terms of pharmacy technicians, we would have, I would say we would have probably around 14 right now, and for pharmacists we have 7 full-time, a part-time, and a part-time as well. And that's not including our manager. So.
Okay, great. So the reason that we've been doing these interviews is to hear about the experiences of our staff members throughout Horizon during the COVID pandemic so far. So I wanted to go back to your practice. I'm thinking about before COVID-19 up until now. How has your practice changed since all of this began?
So since the COVID pandemic, we've kind of changed things. The unit that I cover, before, attending physicians used to come in and see their own patients, but once COVID came, we kind of changed all that around. So right now on my unit, our hospitalist is seeing every patient on the floor. So that's to prevent physicians from actually, coming into the hospital unnecessarily. So it's actually been an improvement in the way things happen on our unit clinically. For me, I've managed to develop a fairly close rapport with the hospitalist here, and because prior, I guess, to COVID, so much of what I did on a daily basis was contingent upon physicians coming into the hospital and making decisions pertaining to their patients. It was kind of a little bit disjointed at times, and in terms of discharge and discharge med-rec, counseling patients prior to discharge, it was often difficult to get that done just with the timing of physicians coming onto the unit. So it's a lot better now, actually, where you're dealing with one physician. I'm rounding actually with the physician more regularly. I'm sitting down when he goes through the charts, seeing patients, and more involved, I guess, in direct patient care. He's asking me for recommendations because he knows as a pharmacist, and he has the time, I think, to devote to those patients. So it's been great for the pharmacist as well. So I guess we actually have more time to do what we're supposed to be doing because the physician is actually spending more time on that particular unit, and it's just one physician you're dealing with.
Yeah, that's great, Keith. A lot of positive changes
For
have come
sure.
out of this for you. And have you gotten any feedback from the physician or the nursing staff now that they're spending more time with you and you're actually rounding with the physician? Have they commented on the positive impact that the pharmacist has brought to their practice?
Not directly, but you can get a sense. I think that particular physician is getting more of a sense of what we have to offer on the particular unit, because he's asking asking more of the pharmacist and asking of our input. I think he's gaining a greater appreciation for the service that we can provide on the unit, which is awesome. I mean, it's developing more into a collaborative practice, I guess.
Wow, yeah, that's great. So a lot of good things to come out of the
For
situation.
sure, yeah.
Awesome. Aside from that, changes to your practice on the unit, have you seen any other successes or improvements that have occurred in the main pharmacy department?
Um, in terms of our day-to-day operations, we kind of handle things a little bit different in terms of our staffing. We split our staff up into two teams. So there is kind of a rotation now on a daily basis. Um, I would say there's days that we struggle to make sure gets done, but I think one thing that I've continued to be impressed with is the commitment of the staff to what we do and serving our patients. So we always tend to find a way to get things done, so regardless of our staffing. So it just basically confirms what I already knew.
Hmm. Yeah, really coming together and working as a team to
For
benefit the patients.
for sure, I mean, it's sometimes there's a lot of good comes out of these adverse situations. So it really kind of solidified for me, the great team that we have here in Miramichi. So
Mm, good. So have there been any challenges that you've been faced with over the last few weeks?
I think just in terms of clinically on the floor, we've tried to become a little bit more creative in terms of how we speak to patients and how we garner information from the patient. We try to avoid going in to actually see the patient in their room if possible. So we've spoken to them through by phone, or there's a lot there's a lot of elderly men who rely on their wives to manage their
Yes.
medications. So we've had a lot of conversations with wives over the phone, or daughters of male patients, and so you have to be a little bit more creative in terms of how you get information.
Hmm. For sure. That's not the first time I've heard that
Yeah.
comment. Yeah. Yeah, it's been opportunities to be creative for sure and find other ways of doing things.
Yep.
And a lot of the time, I've found in my experience, the telephone interviews are sometimes more efficient with the patients over the phone.
For sure, for sure, and it's really good because sometimes you'll go in and speak with the patient, and they're not kind of. I mean, there's a lot of things obviously going on with the patient while they're in the hospital, so it's really good to speak to a family member who's more perhaps involved in the patient's medication. So it does tend to be more efficient and time consuming in the long run.
Great. And the last question I had for you, Keith, was looking back over the last couple of months, what stands out to you as something you've learned either about yourself or the people that you work with?
I think just in terms of our team here in Miramichi, just again reiterating what I've already said, how committed we are here. It's been a difficult time for everybody, not just in terms of what we do here in the hospital on a daily basis. I mean, it's kind of upended our personal lives as well, and but regardless of the challenges, we come into work every day. We try to do what's in our best interest for the patient. And we, for the most part, we go about doing it with a smile on our face.
Yes.
So, it's really nice to see that, and makes me proud to be a pharmacist and to be part of this department.
That's awesome. Thank you so much for sharing that and sharing all of your stories. Like you said, I know in many ways it's been very difficult personally and professionally as we go through this, but to hear some of these positive things that are coming out of it and lessons learned, I want to thank you for taking the time today to share that with our staff.
You're certainly welcome anytime.
Anything else you'd like to add before we come to a close?
No, I think that's about it. Anybody who's listening to this, I wish them well, and I know I know we'll get through this, and I just encourage everybody to do their best, and hold their head up, and all the best.
Great. Thank you, Keith. Were you able to get an appointment with your hairdresser?
Actually, my wife made an appointment for me. She said it was getting a little bit out of control, so, so I actually have a hair appointment on Tuesday.
Very
So I'm going to
good.
get it cut good and close this time, because you never know when we're going to go back to the to
Yeah, that's
phase
right.
red.
Get one that will last for a while.
Exactly.
Awesome. Well, thank you, Keith, for joining us, and thanks for everybody for tuning in.